Hello, everyone. Welcome to another edition of Medicare Monday. I am your host, Joseph Katz, here again with CoverRight CEO Richard Chan. Richard, how's it going?
Doing well. Hello, Joseph.
Excellent. So, want to talk today about the best Medicare Advantage plans. There's lots and lots of rankings, like every industry. Yeah, there's people ranking products and services. So I want to sort of dig into what does that mean, and is there such a thing? And we can take it from there. So, Richard, what's the best Medicare Advantage plan?
So it's an interesting question because I think our view has always been that the best Medicare Advantage plan for you may not be the best Medicare Advantage plan for your friends or your neighbors or even your spouse. And the reason for that is because healthcare is a very personalized situation and topic, and so when you think about how a plan matches your needs, it can differ like everything else. And so it's a difficult question to answer. There are things to look out for when you're considering what is best for you. But is there a best Medicare Advantage plan? I think that the short answer is probably no. There's probably a best one for you, which might not be the best one for everyone else.
So, as you were speaking just now, it occurred to me that there's actually an underlying assumption in the actual question itself, which is that people know that they want Medicare Advantage versus Medicare Supplement, or sticking with just the regular plain old government insurance. So maybe let's dig in for a quick second. I know we've done some other videos, and I'll link to them on Medicare Advantage, but maybe just a quick second or two on what Medicare Advantage is, and then we can kind of like dig into a little bit about how people should evaluate their potential option.
Yeah. So Medicare Advantage is a program where private insurance companies contract with the federal government to deliver you Medicare. And so when you pick a Medicare Advantage plan, what you are actually doing is you are making the proactive choice to no longer take your Medicare directly from the government under A and B, but to take it through the plan that you are getting the coverage from. And the important thing to note in terms of what that means is it means that that plan can do a few things, which is dictate, the doctors that you can see. So you have in-network doctors, out-of-network doctors. You can dictate the co-pays that you have to pay. Each plan has its own list of co-pays. And it can also, decide, whether you are authorized for certain services or not,
Right.
whether they deem that appropriate. Yeah.
They're primarily HMO or PPO models of healthcare.
Yeah.
They do some of those plans come with additional benefits, which is why a lot of people like the Medicare Advantage, dental, the drug plans usually included, vision, etc. So that's a quick overview of what Medicare Advantage is. Medicare in general, I think, many people don't realize varies based on where you're located, correct? So the plan available to you in New York City may be different than Los Angeles or Chicago or wherever you might be. So the question best plan, it has a geographics element to it as well.
Yeah, that's right. So Medicare Advantage plans, enrollments are based on, typically the county that you are in. And so the plan that's available to you, while it might have a similar name to someone else's plan in a different state, it could be very different in what it covers.
And, there are, as I started off this video, these lists, Consumer Reports, 10 best plans. So how do you think they're evaluating these plans? Is it based on the company, or is it based on the coverage, or some other metric? I mean, I know you don't know the answer purely, but I'm just your hunch.
No, it's normally a vague sort of combination of reasons, and it might include, some of the editors of that page going through and trying the experience, whether they, like the overall customer service. It could be some, loosely defined qualitative factors that they deem to be relevant for evaluating a health plan. But there's no clear-cut answer on how they're coming up with it from what I've been able to see. The one thing I would note is that the federal government does also have its own star rating system that they apply to each plan, which we, when we're advising clients, do use. That is an important star rating system because the CMS, which is the regulator for Medicare, will rate each plan based on things like, how they manage chronic illnesses, member experience, member complaints, some of the performance from a health perspective of members in a plan. And so, if you're looking for a more objective review, and again, that's not the full
sure,
reason why you should be in a plan, like that's a good place to get a sense.
Yeah, so I think the key message here, if people take one thing away from this conversation, is that Medicare selection is very personal based on your health and medical needs and how you like to receive and pay for that, as well as where you're located geographically, so that you can make sure you're getting truly the best Medicare coverage.
Yeah.
So why don't we take 1 minute and, not to turn this into a commercial, but explain how you think, CoverRight solves that problem for people who are looking for the best Medicare, for their needs.
Yeah. And so, our platform has always been to deliver transparency for consumers who are looking at evaluating different plans. And so what we do is to provide a really simple and seamless way for you to do that. And what I mean by that is there are a few very key factors that you do have to compare before selecting any Medicare Advantage plan. And the first would be doctors and doctor networks, whether your doctors are in that network. The second would be drug costs, which is probably one of the larger out-of-pocket costs that could significantly change plan selection. And the reason for that is drugs are covered very differently under different plans. So the same drug could cost very different across two plans in the same area. And we've seen that range up to 200 to 300%. So we allow you to easily add your doctors, add your drugs to match the plans that have those within them. And then we allow you to match the benefits that you want. So do you want dental, vision, hearing? And we give you the transparency on, what does that actually entail? What does it include? How much of it do you get? And you get to see all the plans side by side. And so you can make a decision for yourself based on the trade-offs, whether that's I want more dental or I want a PPO, for example, and I want more flexibility. And I'm happy to take on more cost share in order to do that. Like we allow you to easily make those decisions.
I think, and then you add on the star rating, right? So someone who is truly interested in what the company's rating is can look at that as well at the same time and get a picture of is this the right company? Is this the right benefit? Is this the right price? Am I comfortable with all these things? And then make their final decision. Am I getting all the coverages I need?
Yeah.
All right. So short answer is no, there is no best. It's like you said earlier, it's what's best for you and your particular situation. Richard, appreciate the insight, the time. If anyone has any questions for Richard or the team at CoverRight, they can reach out to hello@coverright.com. They can visit our learning center, which is learning.coverright.com. Happy to always help answer questions, work people through the process. And we encourage everyone to subscribe to this channel. We post these videos weekly, and we look forward to seeing you next week. Thanks for watching. See you soon, Richard.
Thanks, Joseph.